It has almost been a year since China reported its first cases of COVID-19, and with vaccines still in the works, cases and deaths continue to rise. So do medical expenses of patients battling the disease for days, even weeks in hospitals. What is the role of the Health Maintenance Organization, or HMOs, in this COVID-19 crisis? Let's now have an exchange with industry official Carlos Da Silva. Mr. Da Silva, maraming salamat po for joining us. Ano pong ginagawa ng HMO industry para tulungan ang gobyerno at ang ating mga kababayan ngayong may pandemya?
Okay, Rico. To begin with, under an HMO setting, a DOH declared epidemic, much more a WHO declared pandemic, is an exclusion to a traditional HMO coverage. However, in keeping with the country's bayanihan to heal as one, HMOs in the country are covering COVID-19 up to the plan holder's maximum benefit limit or aggregate benefit limit. So they are covering COVID-19 to date as we speak.
So, Mr. Da Silva, pakinggan po natin ngayon si Annalyn Dalangin, isang employee from a financing company, and she has a question about HMO coverage.
Kung sakali magka-COVID-19 ako, ano nga bang maximum coverage ang makukuha ko sa isang HMO?
Ayan, Mr. Da Silva, ano po yung maximum limit for an HMO client na magkakaroon ng COVID?
Under a COVID-19 plan agreement, you have outpatient, inpatient coverages, you have emergency care coverages, including preventive health care. So all of these get into the picture. Now, if you have COVID-19, the upper respiratory illnesses, then anything and everything that is required for a COVID-19 patient to get better, to be managed, all the management protocols are coverable up to the plan holder's maximum benefit limit for that particular illness. Of course, it goes without saying that during a SARS-CoV infection, other comorbidities come into play, and therefore it carries a separate maximum benefit limit. So the aim here is to get the patient well so that the patient can be discharged.
And we have a question now from a marketing officer, Mr. Da Silva, Chris De Vera. Let's listen to what he has to say.
Will it matter how the COVID was contracted by the person? Let's say, does it matter if it was contracted during work hours because of having to report to work versus maybe through contact tracing, they see that it's because the person went to a mall over the weekend?
So, Mr. Da Silva, does the HMO investigate how the client patient got infected by COVID?
It doesn't really matter how the patient got COVID-19. The important thing is he got covered, he is sick, he goes to an affiliated hospital, he uses an accredited doctor, and he gets covered up to his plan agreement's maximum benefit limit or aggregate benefit limit. It doesn't really matter if he picked it up in some mall, in some place, elsewhere. As long as he got it, he is covered.
This is very good information that you're sharing with us, Mr. Da Silva. And of course, sa pandemyang ito, hindi rin natin pwedeng makalimutan na hindi lang COVID, meron pang ibang mga sakit na kailangang asikasuhin. I mean, you have the likes of cholera, dengue, among others, na kailangan din ng coverage.
Correct. As I said earlier, when you get SARS-CoV-2 infection, it lowers your immune system. And therefore, if you have other comorbidities, it is almost certain, like hypertension, diabetes, it is almost certain that they get aggravated. And therefore, they come into play while you are confined, particularly for COVID. it is possible that your diabetes, your hypertension, any other health conditions may appear, and therefore it is likewise covered under a separate maximum benefit limit, because a coverage of an HMO is per illness or injury per year.
We would like to thank you, Mr. Da Silva, for this very informative health exchange. HMO industry official Carlos Da Silva.